Thank you. Okay, we're going to get right into it so I have time. Anyway, basically, you've heard of all of this before, and it's kind of nice that you have, because when I first lectured this, and I've heard it before, there was only one lecture maybe or two lectures on this, and now you're starting to see it more and more. But the therapy is definitely, the amniotic membrane therapy is a paradigm shift in how we're looking at healthcare to our patients. And we're going to see a whole lot more of this going on over the next several years. You're going to see a lot more research papers and definitely evidence-based medicine. There's not the large studies yet, but they are coming. The tissue actually revitalizes and reinforces the surrounding healthy tissue. Different in its mechanism because it actually sends a signal to the normal tissues to come on board for healing. And I think that's the key here, that it signals and recruits healthy cells to migrate to the non-healing, dead, devitalized tissue. The amniotic membranes and fluid have been around for over 100 years for healing and healing potentials. It is actually an excellent source of growth factors, as you heard, and also for nutrients for wound healing and tissue healing. There's a whole bunch of research going on. I won't reiterate this because you've heard a lot of this before, but if you want to go back into my lecture, you'll see some of the articles that have been written on this, experimental and clinical studies, as well as how several growth factors are affected, and also the presence of mesenchymal stem cells and what they do to differentiate cells for healing. Again, we've seen this slide over and over again, today specifically, so you should get a good idea that these cells are around at birth and decline over age. And so as you age, you have less and less ability to heal a wound. Now add the risk factors of diabetes, vascular disease, renal disease, and other diseases, and your chances of healing are even less. The amniotic tissue and fluid is regulated by the FDA under a section called the 361 of the Public Health Service Act, and it is approved as a minimally manipulated soft tissue void filler in a lot of the types of tissue that I'm going to talk about. It's minimally manipulated, pertains to the process that does not alter the original characteristics of the tissue, utility for repair, reconstruction, and replacement. The 361 HCTP is the human cell tissue and cellular and tissue products. So you have an idea what those two things are. The tissue actually has multiple growth factors, as you can see, type 1, 2, 3, 5, and 6 collagen. You have VEGF